So Anna Maria Vranceanu is back on the podium to talk about quality of life trials.
Yes, okay. So I have to go really quick, I hear. Okay, so I was tasked to talk to you about, to provide a brief introduction to psychosocial clinical trials in neurofibromatosis. So we're gonna talk about why do we care about psychosocial clinical trials in NF, what is the purpose of these trials, what are the ingredients of a successful psychosocial trial in NF, what are appropriate outcomes, so what are some things that we want to measure and see improvement in. How do we evaluate a psychosocial trial? I think most of you are familiar with the drug trials, but things are a little bit different for psychosocial trial. How do we develop a tailored psychosocial intervention for NF? What are some of the ongoing psychosocial clinical trials that are happening right now in NF? And what are some future directions? Okay, so why psychosocial trials? I think you've heard me talk about this earlier today, but NF is associated with substantial psychosocial burden. And this occurs in children, adolescents, in adults, in parents, NF1, NF2, Schwannomatosis. And what's really important is, and maybe a surprise to many of you, but the psychosocial burden may or may not correlate with the severity of disease, right? So I think it's easy to assume that the more symptoms you have or the more tumors you have, the lower your quality of life or psychosocial functioning, but that's not really the case. For example, in NF1, the number and size of the cutaneous neurofibromas does not always correlate with emotional distress. In NF2, for example, most people experience emotional distress when they lose their hearing, but some of them adjust and others don't. In Schwannomatosis, the tumor size or location doesn't always correlate with a self-reported pain. And sometimes decreasing and removing the tumor doesn't necessarily, lead to patients becoming symptom-free. And so it's really, really important then to, in addition to the medical care or the drug trials, to also do psychosocial trials. And I'm not gonna go over the slide again because you've seen it earlier today, but really what this shows is that currently we know a lot about, and we're learning more and more about the biological aspects of NF, and that's great, and we have a lot of drug trials, but quality of life and health are impacted by this interaction between biological factors, but also social and psychological factors. So what is the purpose of the psychosocial clinical trials? We want to decrease the psychosocial burden in NF. We want to improve symptom management, improve success of medical procedures. We've seen this with other medical populations. We want to empower patients with the coping skills necessary to navigate symptoms and stress associated with NF. We want to ensure that programs comprehensively address all the needs of patients with NF, all patients with NF, regardless of disability, age, ethnicity, and location. So what are the ingredients of a psychosocial trial? So first, we need to have appropriate primary and secondary outcomes. So these are the things that we want to measure. And so we do this by getting feedback from literature and then by talking with patients to figure out what's important to them. And the REiNS PRO group has been working really, really hard for the past few years to try to identify what are some really good outcomes and what are some really good measures that we can use to assess these outcomes. We also want to have appropriate psychosocial interventions, right? So we want to develop interventions or adapt existing interventions with feedback from patients to really make sure that these interventions address things that are important to patients. And we also want to target theoretically sound constructs, and we do this by, again, going back to the literature. I put this thing here that the interventions are different for children, adults, adolescents, and parents, because I've recently had an adolescent psychosocial interventions reviewed by the Department of Defense, and it got an outstanding score, but I didn't get the funding because the reviewer said, you already have a program in adults, why do you need a program in adolescents? This doesn't make sense to us. And so, it was frustrating on one hand, but it was also, really important to understand that not a lot of people know that in drug trials, you may have a drug that works for adults and adolescents and children, but in psychosocial trials, the way we explain skills to adults is completely different than the way we explain skills to adolescents or children. We also want to have a credible and ethical control group, right? So in drug trials, you have a placebo pill that you give patients, and they don't know that whether they're getting the intervention or not. And that allows you to be sure that if there is improvement, it's because of the drug, not because patients, not because of other compounds. So we don't have this in psychosocial trials, and we need to come up with a control group that is close to a placebo pill. And so a lot of the times people are thinking of using a waitlist control, so you get the intervention later, but is that a placebo? Not really, because patients actually know that they're not getting the intervention. So a lot of the work that we're doing is trying to understand how can we come up with a control group that's credible. Because it's really important to keep the participants masked to whether they get the intervention or control. And finally, we need scientific rigor. So we need to have trained clinicians, we need patient manuals, we need to rate adherence to the interventions. So a lot of the things that we may not need to do in drug trials, we have to do in psychosocial trials. So what are the appropriate outcomes? So again, primary outcomes, the most important thing that we want to measure, and we develop them with feedback from patients. The most important quality of life the most important measure that we're looking at right now within the REiNS Pro group is the quality of life, which is really a perception of overall well-being. And it has psychosocial, physical, and social components. And then we have more secondary outcomes, so things that we're going to look at as well, but perhaps they're not that important. So these are things like pain, depression, and coping that we're addressing as part of the trial as well. So how do we evaluate a psychosocial trial? So in psychosocial trial, we have different stages of intervention development than in the drug trials, and I'm not going to go over that, but some of the things to keep in mind are feasibility, right? So we want patients to sign up. We can have a great trial. If patients don't sign up, it doesn't matter. We want the program, the intervention, to be acceptable, which means we want patients to start the program and finish it. We can have a great intervention, but if it asks patients to come to the hospital for 2 hours once a week, most likely they're going to drop out. Or if the materials that we teach are not relevant to the patients, then they're going to drop out. We want the program to be credible. So we want to be able to tell patients about the program, and we want them to believe that the program is going to help them. We want patients to be satisfied with participation in the program. And so at the end of the study, we need to ask them questions, and ideally we want them to say, yes, I believe that this trial helped me, and I'm really satisfied. I think it addressed issues relevant to me. And when we have a control condition, ideally, we want patients to also be satisfied with a control condition, because in this way, in psychosocial trial, we know for sure that patients remain masked to what we considered was the active intervention. We want the trial to have efficacy or effectiveness, so we want to be able to show that the intervention leads to improvement in the primary and perhaps secondary outcomes over and above our control. And hopefully in the future, we'll be able to do effectiveness trials where we're going to compare an intervention that we know works with a new intervention, and to see if the new intervention works the same or better. We want durability. So we want to help patients improve, but we want to sustain that improvement over time, so we need to measure that. We need scalability. So once we have an intervention, can we take that intervention and implement it for all patients with NF as the new standard of care? And can we have that covered by insurance, or can we find a way to pay for that to make it available for everyone? And I thought that very briefly, I'll show you how we developed the psychosocial program at Mass General. So we started in 2012 with a systematic review, and we found that patients with NF have very low quality of life. And so we did focus groups with patients, and we learned that they're interested in participating, and we learned about the NF-specific stressors, and we adapted a program for the needs of patients with NF. We tested it in what we call an open pilot. We had them come into the hospital. We administered measures before and after the program, and we found that almost everybody improved in quality of life and pain and coping, but it was really hard to get people to sign up, and many of them dropped out because they couldn't commit to staying in the Mass General area. And so we did exit interviews with these patients. And again, we learned from them how we can make the intervention better. And we learned from patients that if we deliver this program through live video, we're going to have them actually be more interested in participating. And they told us that some of the language we used was too complex, that we asked them to do too much. And so we did a major revision, and we got some funding from CDF, and we conducted a preliminary randomized control trial, and through Skype, and with that data, we were able to get a full funding from the Department of Defense, and we're now conducting a fully powered randomized control trial that in 4 years, hopefully, we'll have something to offer the community, something that, works for all adults with NF. But that will be that will be in 3 years. So overall, if we think of the amount of time and effort that takes for a psychosocial study to do it really well, it's about 6 to 8 years. So a very long time. Okay, so we've got completed psychosocial trials in NF. They're mostly pilot studies, which means we use a small sample of patients, and we really need to do them again with a larger number of patients to make sure that effects maintain. And there are ongoing psychosocial trials. I just finished up a trial in patients with NF2 who are deaf. Stacy Martin is conducting a pilot study sponsored by NTAP, and then we've got the DoD trial that's in adults with NF. So a lot of things are happening, and maybe there are others that I'm not aware of. And so in terms of future directions, we want to increase the number of psychosocial trials across NF types and ages. I hope that we convinced you today that this is really, really important in addition to the drug trials. We want to extend our reach to all patients with NF, including those in rural areas who may not be connected with CTF. In all my work with NF, we get primarily white women interested in participating, and obviously that's great, but we would love to have more men interested, and we would love to have a more diverse sample. We want to implement evidence-based psychosocial interventions for patients with NF as part of standard care. So this is really my dream that, maybe in 5 to 10 years, as an NF patient, you're going to go to see your doctor and you'll get your medical care, but then you'll also be asked about how you're coping and what's your emotional stress, and then we'll have something for you that it works. And ideally, we'll have something for adults, for adolescents, for parents, for children. And obviously, patient representatives play a key role to share own perspectives about the needs of the larger NF community, to serve as a liaison between patients and researchers, to educate and engage the larger NF community, right? So ideally, you'd go back to your communities and you'll be able to say, I've learned about psychosocial research, I think you need to participate, or I've learned about other clinical trials, I think you need to participate. And the idea is to really help extend our reach to all patients with NF. Thank you. Hope that's great.